Hi everyone, you're welcome once again to my YouTube channel. So in this video, I'm going to be covering must know topic for fundamentals. For me, fundamentals of nursing, that's the foundation for nursing practices. Okay, so these are I'm going to be listing out the area most emphasized in class, skills lab and exams. So like NCLEX and ATI, all this you will come across, okay? You come across it. You will need them for school. You will need them for your NCLEX. So let's dive into it. So I'll start with nursing process. Your 5 nursing process, ADPI. You have to know, what do we do in ADPI? You collecting data. That's when you're getting your nursing diagnosis. You're planning. You're implementing, and you're evaluating. So I will leave it at that. And the next one I'll talk about is basic nursing skills, okay? Basic nursing skills, what do we do? That's when we get vital signs, normal ranges, how to measure, how to interpret, hygiene and comfort care. That's when we learn breathing, oral, bed making, how you can make a bed when patient is in bed, when they're out of bed, positioning and transfer, safety, good body mechanics, applying restraints and safety devices, intake and outputs, how to measure intake and output. Those are the things we learn, okay? Those are the things we learn under our basic nursing skills. So the next one is infection control. In infection control, this is when you learn your chain of command, standard precautions, transmission-based precautions, hand hygiene, steps to perform, how to perform proper hand hygiene, how to don your PPE, how to doff it. Okay, so in this section, that's what we're going to be covering. And I'm going to still go over all of these one after the other. I'm just listing out the topics that we have to know, must know for us. So the next one is medication administration. In this is when you know your CIS rights. This is when you know your routes, the proper route to administer your medication, the common route like PO, IM, IV, subcutaneous. What am I missing? This is when you also learn your calculations, dosage calculations. This is when you understand your drug classifications. What am I missing? This is when you learn both drug classification and their effects. Okay, this is when you recognize medication errors and safe reporting. You understand? So the next one is safety and mobility. Under safety and mobility, this is when we cover the 4 preventions. Home safety, use of assistive devices, right? Like canes, walkers. We have to learn all of this. Proper body alignments, transfer techniques, range of motion. Yes, this is when we learn all of this. Safety and mobility. The next one is vital signs and physical assessment. Vital signs and physical assessment. This is when you know your normal ranges of vital signs. You have to know it. This is when you learn your head-to-toe assessment. This is when you recognize abnormal findings. If you check vital signs, if the blood pressure is low, this is when you know if it's high temperature, low temperature, high pulse reading. These are the things you learn under vital signs and physical assessment. Head-to-toe assessment. You will do this head-to-toe assessment until you are tired. You will do it, even when you get to the field, of course. So you have to know it. Let me see. Let's talk about communication too and documentation. Under communication, you have to learn therapeutic communication, how to communicate with your patient appropriately, the right words to use. Okay, you don't want to be too harsh. And in this process, that's when you use your SOPI. We'll talk SOPI, your subjective, objective, assessment, planning, implementation, evaluation. You use this. You learn your SBAR too in this process. SBAR is used when you call your doctor. SBAR, situation, the background, SBAR, yes. A, the assessments, R, the recommendation or the read back. You understand? S bar. What am I missing? S is situation, B is background, A is assessment, R, yes, is recommendation or readback, okay? In that process, what are you doing? Situation, you are, okay, I will still explain all of this anyways. I'm just listing out the must know topic for now. Another one is legal and ethical concepts. Legal and ethical concepts, that's when you know patient's rights. This patient have rights, and you have rights too. Confidentiality, Tayo, come on now. Informed consent. Before you do anything, you need this patient to approve. If you want to take vitamins, you always have to get informed consent for anything at all you do. Ma'am, is it okay for me to touch you? Ma'am, is it okay for me to check your vital signs? Ma'am, is it okay for me to do your treatment? You always have to do that. So, IPA, legal and ethical concepts. We also cover negligence, malpractices, advocacy, and professional boundaries. These are the things we learn and under legal and ethical concepts. The next one is basic care. Yeah, basic patient care. Nutrition. You want to learn how to feed this patient right. Proper feeding techniques. You know, some patients, they have dysphagia. There's a way you feed these people, okay? People like that, there's a way you do it. That's when you also learn elimination, like urinary and bowel care. When this patient uses catheter, you learn your Foley catheter care, skin integrity, pressure, ulcers prevention, sleep and rest positioning, and promotions. This is when you learn all that under your basic patient care needs, okay? Now, another one is fluid and electrolytes. An acid-base balance. That's when you recognize when your patient is dehydrated. When common electrolyte imbalances, sodium, potassium, you have to know their normal ranges. We'll still talk about that. IV therapy, basic care, you know, that's when we learn all of this. Fluid electrolyte balances, acid-base balance, you must know them. You have to. Another one is cultural competency and spiritual care, because some of those patients, they are from different backgrounds. American, you know, we're dealing with different kind of people from different backgrounds. And as a nurse, you have to be professional. That's a way you have to respect their culture. You cannot mandate your culture on them. This is how we do it in Nigeria. In my own country, we don't do it this way, and I'm not going to do it the way you say, because this is unacceptable. You cannot do that as a nurse. You have to. In fact, that is very, even if they want to hire you, you will definitely answer that question anywhere you go. If you want to be hired, they will ask you questions on what your cultural competencies look like, okay? So it's a must know. You have to know it. And another one I'll talk about is health and promotion. Yes. What do we do in health and promotion again? I can't even remember. In health and promotion, what do we do? I think that's when we teach lifestyle modifications, right? In health and promotion, this is when you teach lifestyle modifications. This is when you teach primary, tertiary, secondary preventions. And the last but not the least, that I will never forget, you have to know your aseptic techniques. You have to know your septic techniques. You have to know perioperative care, intraoperative care, post-operative care. You have to know all of this. So everything I've listed here, these are your must-know topic, okay, for fundamentals. And I'm going to be breaking them all down one after the other. So Nosti got you covered, okay? Don't give up on me yet. So I will end this video here now. If you are yet to subscribe, let me beg you. I'm just begging now. Please subscribe. God bless you. Please. Thank you so much. Subscribe. Bikonu. Please. All right. And everything I've listed here, I will be, explaining them, what they mean, how to apply them, and what to do one after